What age are child temper tantrums most common? Imagine a tiny person trying to navigate a big world with a small voice. Sometimes, they get overwhelmed and their feelings burst out in a loud, upset way. That's what we call a temper tantrum. If you've ever seen a toddler throw themselves on the floor or scream when they can't get what they want, you know how intense these moments can be. But when do they happen the most? Most temper tantrums start between 12 and 18 months old. That's when children are just beginning to understand their feelings but don't yet have the words to express them. As they grow, they learn to say what they need, but they still struggle with big emotions. The real peak happens between 2 and 3 years old. During this time, tantrums are more frequent and often more intense because children are testing boundaries and seeking independence. They want to do things on their own but don't always succeed, which can lead to frustration and outbursts. After age 3, tantrums tend to become less common and less severe. This is because children develop better language skills and learn ways to calm themselves down. By age 5, most kids have more advanced communication and coping skills, so they handle frustration more effectively. However, some children might still have occasional outbursts, especially during stressful times or when they're tired or hungry. There are many reasons why tantrums happen at these ages. Kids have limited vocabulary, so they can't always tell you what's wrong. They also get upset when they can't do something they want or when routines change unexpectedly. Sometimes, they're tired, hungry, or uncomfortable, which makes their emotions harder to manage. Feelings like jealousy or wanting attention can also trigger a tantrum. From an emotional regulation point of view, tantrums are a normal part of growing up. They show that children are learning to handle strong feelings. When caregivers stay calm and respond kindly, they help children learn how to cope better. Distraction, a quiet space, and talking about feelings afterward are good ways to support kids during these moments. Making sure children get enough sleep and proper nutrition can also reduce tantrum frequency. While tantrums are common in toddlers and preschoolers, if they happen very often or last a long time after age 5, it might be helpful to talk to a professional. Overall, knowing that tantrums are a normal part of development helps us be patient and supportive. Most children go through this phase as they learn to manage their emotions and communicate their needs more clearly.